Hello, hello, welcome to Lab Chat YouTube channel. I'm Johnston. This channel is courtesy of our clients who in daily practice ask us questions pertaining their health, pertaining the tests that are done in the lab, the implications, what the tests mean, and we found that it's important we share this to many of our clients, but because again we cannot be sharing just to one person, the information, the cascade of information might be altered. uh, this channel therefore is a platform for both our clients, that is the patients, uh, the people, other medical practitioners, the caregivers or other caretakers to the clients, the parents if it's for the underage patients. So I would urge that you take this platform one of your own, and always ask as many questions, discuss, mention all the issues that you feel you need to understand so that we can keep moving forward. Diagnostic uh, techniques, or rather medicine, is one area that has not been put into discussion a lot to the public, but we are hoping that this platform is going to create information and also a room for even those who never understood certain concepts can really understand. Uh, for any comments, any concerns, compliments, and any other adjustments that you think we can have in this lab chat channel, then we welcome it so that we can keep moving forward. Okay, um, maybe just to mention that this platform will mostly link uh, medical work to layman work, and coalesce them so that everything is understood as a separate. Uh, Once again, if you are new to this channel, of course, we are all new. I'm also new today. Um, Kindly subscribe, and you can always click the notification bell so that when we upload a new video, you can always be notified, and share your opinions, share your suggestions, uh, share your general feelings about the video, and I'm very hopeful that we are going to do well. Today, starting, we can't just talk and uh, fail to discuss something. Uh, you know very well there is this disease, a chronic disease. It is non-communicable, that we call diabetes. Uh, Today I wanted to discuss about diagnosis of diabetes. First, one has to know what is diabetes, and actually diabetes is a condition where uh, your body fails to regulate its sugar, and now the sugar becomes abnormally high, and maybe in this respect we most of the time refer to diabetes mellitus, because of course we have diabetes insipidus, which has another uh, physiological explanation, but today we are going to deal with diabetes mellitus. uh, we have two types of diabetes mellitus, and that is type 1, that is insulin dependent, and type 2, which is non-insulin dependent. Insulin dependent means that actually it is because you don't produce insulin, because your body does not produce insulin, and that's why you have diabetes. While type 2 diabetes is where probably you might be producing insulin, but because there is resistance, your cells are resistant to insulin, or the insulin is just not sufficient to serve you, or rather to clear your sugars, then you become diabetic. Now, we have three major criteria or methods that we use in diagnosing diabetes. And one is we can use the fasting blood sugar. We can use oral glucose tolerance test. We can use the A1C, or what we just call HbA1c, to diagnose diabetes. Now, it is also important to know in diagnosis of diabetes, we refer to certain ranges. We cannot discuss diabetes without referring to ranges, and not just ranges for anything. It's ranges for blood glucose, not any other thing. It is blood glucose. That is in reference to blood glucose. That is what we call the ranges. Now, today, like I had prepared something here, and first let us share the ranges so that we know at what point do we say one is normal, one is diabetic, or one is some inches to being diabetic or pre-diabetic. Now, with the fasting plasma glucose, the normal ranges are at least below 5.6, and when it is below 5.6, then we can say you are normal. And if it is 5.6 to 6.9, then we say you are pre-diabetic. And if it is 7 to or over 7, then we can say you are diabetic. For oral glucose tolerance test, that is after 2 hours of the test, then if you are below 7.8, then we say you are normal. If you are between 7.8 to 11.0, then we say you are pre-diabetic. And if you are above 11, you are either 11.1 or above, then we say you are diabetic. For HbA1c or A1c, we expect your percentage for the glycated sugar to be around 5.7 or below. If it is 5.7 to 6.4, then we can say you are pre-diabetic. If it is 6.5 and over, then we can say you are diabetic. However, sometimes it is a challenge to just use one single technique to diagnose diabetes, and it will force, or rather it will involve a discussion for correctly identifying whether if you are diabetic or not through various techniques, various methods. Now, the ADA has provided recommendations for when to test diabetes, and these are the recommendations. Maybe if I may share, if your BMI is above 25, then you are a candidate to just check or screen for diabetes. If you are over 45 years, then it means at least every 3 years you should be checking for diabetes. Women who had previously had gestational diabetes, they are likely to be diabetic in future, so they are also recommended to be testing. Then we have those who have tested pre-diabetics or pre-diabetes, that is the fasting plasma glucose, the A1C, the OGTT, has shown results suggestive of pre-diabetes. So these people, at least every 1 year, they should be checking for diabetes. Now, we are going to go straight because fasting is fasting glucose is the easiest to test. You just fast for 8 hours. That is, once you take your supper in the evening, then you make sure you go to the lab before 9 a.m. so that we take care of the circadian rhythm. You see, when you are past 9 a.m., then you are starving, and your body mobilizes other gluconeogenic processes so that sugars can be regenerated back into the system to sustain you, and that sugar is now misleading because it is not the actual sugar that is just floating, or rather is present in your vessels. uh, that's why we say you cannot test fasting blood sugar past uh, 9 a.m., or it depends. If you slept maybe 11, then we can extend the